Gentlemen, imagine you're sharing one of the closest moments two people can experience together. In that quiet space, while your attention is focused on the connection between you, there is a question that has probably crossed your mind at least once, even if you've never spoken it aloud. What is she truly experiencing in that moment? Not what she says afterward, not the expressions you can see, but what is actually happening inside her body and mind as intimacy unfolds. It's a question many men have carried for years without ever receiving a clear answer. Unfortunately, most of us were never taught the biological realities behind female arousal, emotional connection, and physical readiness. Today, we're going to change that. In this discussion, I'll explain what modern science tells us about the remarkable changes taking place within a woman's body before and during intimacy, why understanding those changes can strengthen your relationship, and how this knowledge can completely reshape the way you approach closeness with the woman you love. This isn't about criticism or blame. The vast majority of men genuinely want their partner to feel comfortable, respected, and deeply connected. The problem has never been a lack of care. More often, it has been a lack of accurate information. I'm Dr. Richard Ben, and throughout my years studying human biology, vascular health, and the science of the body's most fundamental systems, I've seen time and again how powerful education can be when couples better understand each other's physiology. The body is an extraordinary network of interconnected systems, and nowhere is that more evident than in the biology of human intimacy. Before we continue, if you appreciate clear evidence-based conversations like this one, please subscribe and turn on notifications. Every week, I share practical insights designed to help men improve their health, strengthen their relationships, and live with greater confidence at every stage of life. Stay with me because the next concept is one that many men have never heard explained with this level of clarity. The first thing to understand is that intimacy begins long before any physical contact reaches its most intimate stage. For many women, genuine desire develops through a sequence of emotional, neurological, and physical responses that originate in the brain. When she feels emotionally safe, respected, and genuinely wanted, her parasympathetic nervous system becomes more active. This is the branch of the autonomic nervous system responsible for relaxation, openness, and connection, what scientists sometimes refer to as the rest and digest state. As this response develops, blood flow gradually increases throughout the pelvic region, preparing the body for intimacy in ways that are largely automatic and entirely outside conscious control. Rather than flipping a simple switch, the body activates one biological system after another in a carefully coordinated physiological sequence. As circulation improves, sensitive tissues become more responsive. At the same time, natural lubrication begins as blood vessels supply additional fluid to the vaginal tissues, a process driven by vascular function, not unlike other circulation-dependent responses throughout the body. Another important structural change also occurs internally. The upper portion of the vaginal canal gradually expands while the surrounding muscles become more relaxed, creating greater comfort during intimacy. None of these changes can be forced or rushed. They depend on emotional security, patience, and sufficient time for the nervous system to complete its natural preparation. For many women, especially after menopause, hormonal shifts can slow this process compared to earlier years. Understanding this helps explain why emotional presence, patience, and genuine affection matter just as much as physical attraction, perhaps more. When a man creates an atmosphere of trust rather than pressure, he actively supports the natural biological responses that allow intimacy to become more comfortable, more meaningful, and deeply connected for both partners. That is not sentiment, that is science. Once her body has completed that natural preparation, the experience of intimacy becomes very different from what most people assume. When physical closeness follows emotional connection, adequate arousal, and mutual comfort, the body responds in a coordinated way that involves far more than simple physical sensation. Sensitive nerve endings throughout the pelvic region have become more responsive because of increased circulation, allowing touch to feel more comfortable and genuinely pleasurable. This is why the same physical experience can feel completely different depending on whether sufficient time has been given for her body to prepare. The physiology is not the same. The nerve response is not the same. The biochemistry is not the same. Many women describe this stage as feeling relaxed, emotionally grounded, and fully present rather than simply physically stimulated. That difference is not imaginary. It reflects genuine biological changes occurring throughout the nervous system and circulatory system simultaneously. At this point, the brain also begins releasing oxytocin, a neuropeptide sometimes called the bonding hormone. While the name is familiar, its function is far more significant than most people realize. Oxytocin strengthens feelings of emotional closeness, trust, affection, and connection between partners during meaningful intimacy. It reinforces the sense of safety that allows both people to become more emotionally open with each other at a neurological level. This is one reason why emotional presence matters so profoundly. Genuine attention, patience, and kindness create an environment where these natural biological responses are far more likely to occur and to sustain themselves throughout the experience. Intimacy is never only about physical technique. It is shaped by emotional security, mutual respect, and the quality of the connection two people have built together over time. When these elements come together, couples consistently report experiences that are more satisfying, more comforting, and more emotionally fulfilling than they ever anticipated. Not because the mechanics changed, but because the biology was given the environment it requires. Another reality many men have never fully considered is the extraordinary level of trust a woman places in her partner during intimate moments. Physical closeness is not only a biological event, it is also an emotional decision that depends on feeling secure, respected, and genuinely understood. Her nervous system continuously evaluates whether the environment is safe, often without her consciously registering that evaluation at all. This is an ancient protective mechanism hardwired into our biology. When that sense of security is present, the muscles of the pelvic floor are more likely to remain relaxed. Breathing becomes calmer, and the entire body responds with greater ease. If anxiety, perceived pressure, or emotional distance are present instead, those same protective systems can generate tension that makes intimacy less comfortable, regardless of how willing she may appear. This is precisely why emotional reassurance is never separate from physical intimacy. They are not two different things happening in parallel. They work together as part of the same integrated biological process. Research has consistently shown that elevated stress hormones, particularly cortisol, can significantly interfere with normal sexual response. Elevated cortisol suppresses the hormonal signals needed for arousal and narrows the peripheral blood vessels that support the physiological preparation we discussed earlier. Meanwhile, feelings of trust and affection encourage the nervous system to remain in the calm, receptive state where a healthy sexual response can develop naturally. For many couples, especially later in life, this understanding becomes even more critical. Hormonal changes, chronic life stress, and evolving health conditions can slow the body's natural response considerably, making patience and honest communication far more valuable than any attempt to accelerate the experience. Men often believe confidence comes from performance alone. But I would argue, and the research supports this, that genuine confidence also comes from listening, paying close attention, and responding thoughtfully to your partner's needs. The strongest relationships are built on mutual understanding rather than on untested assumptions. When both partners feel heard, respected, and emotionally connected, intimacy often becomes more satisfying for each person because the body and mind are working in alignment rather than working against each other. That deeper connection is where lasting closeness truly begins. One of the greatest misunderstandings surrounding intimacy is the belief that physical actions alone determine the quality of the experience. In reality, a woman's brain remains one of the most influential organs involved throughout the entire process. From the first moment of emotional safety through every stage of the shared experience, Even after physical intimacy begins, her nervous system continues responding to emotional cues, tone of voice, facial expression, quality of touch, and above all, the sense that her partner is genuinely present with her rather than focused elsewhere. This ongoing communication between brain and body shapes how comfortable, emotionally connected, and fulfilled she feels throughout the experience. When she senses patience, affection, and sincere attention, her body is more likely to remain relaxed, allowing pleasurable sensations to continue developing naturally. On the other hand, if she feels rushed, emotionally dismissed, or pressured in any way, stress hormones can interrupt those responses and reduce physical comfort, even when genuine attraction is present. The neuroscience here is unambiguous. This is why meaningful intimacy is never created through speed or technique alone. It grows from emotional awareness, consistent communication, and a genuine willingness to remain present. Many long-term couples discover that deliberately slowing down actually strengthens their relationship because it gives both partners space to become more attentive to each other's real needs. Rather than focusing exclusively on reaching an outcome, they begin appreciating the connection itself as the experience worth having. This shift often creates greater satisfaction than they experienced years earlier, precisely because both partners are more engaged, more attuned, and more willing to communicate. The goal was never perfection. The goal is learning to understand one another more deeply with every shared experience. When a man approaches intimacy with curiosity, genuine respect, and emotional maturity, he creates an environment where trust continues to grow, making every future moment together more meaningful, more comfortable, and more fulfilling for both partners. As relationships mature, many couples begin to notice meaningful changes in intimacy, particularly during their 50s, 60s, and beyond. These changes are shaped by shifting hormone levels, evolving health conditions, medications, the accumulation of life stresses, and the natural biology of aging. None of these changes mean that closeness has to diminish or disappear. They mean that the body benefits from more patience, clearer communication, and a deeper understanding of how intimacy naturally evolves over time. As a physician and scientist, I want to be direct about this. Aging does not disqualify anyone from a rich and meaningful intimate life. But it does require adaptation, understanding, and a willingness to learn new approaches. For many women, physical readiness may develop more gradually than it did in earlier years, making emotional connection even more valuable than before. Gentle affection, meaningful conversation, and unhurried moments together help create the conditions that allow the body to respond comfortably at every age. This is one of the reasons many couples report that their emotional bond actually grows stronger in later life. Instead of relying on old assumptions or past expectations that may no longer match their current reality, they learn to communicate openly about comfort, preferences, and changing needs. These conversations reduce anxiety, build deeper trust, and help both partners feel genuinely understood rather than misread. Healthy intimacy is not measured by speed or frequency alone. It is measured by the quality of the connection shared between two people over time. When both partners approach each other with empathy, patience, and mutual respect, the experience becomes more than a physical interaction. It becomes an opportunity to strengthen trust, reinforce emotional security, and deepen the relationship in ways that continue long after the moment itself has passed. Understanding these natural biological changes allows couples to adapt together rather than becoming discouraged by them, creating an environment where genuine affection, quiet confidence, and lasting closeness continue to grow throughout every stage of life, with greater understanding and lasting fulfillment. Perhaps the most valuable lesson in all of this is that meaningful intimacy is built on understanding, not assumptions. Many men spend years believing they need to focus primarily on physical performance, when in reality, the emotional environment they create often has a far greater influence on their partner's experience than any technique ever could. A woman who feels emotionally secure, genuinely appreciated, and completely free from pressure is far more likely to experience the relaxation, trust, and physical comfort that allow intimacy to become what both partners are hoping for. These responses are not accidents. They are supported by the nervous system and reinforced through consistent positive emotional connection over time. This is why kindness, patience, eye contact, affectionate touch, and honest communication should never be viewed as separate from intimacy or as preparation for something more important. They are an essential and irreplaceable part of the experience itself. Before we continue, I'd like to ask you a quick favor. If this discussion has helped you better understand the science behind healthy relationships, please take a moment to like this video and subscribe to the channel. Every week, I share evidence-based information designed to help men improve their health, strengthen their relationships, and age with greater vitality and confidence. I'd also welcome your thoughts in the comments. Has anyone ever explained these biological and emotional changes to you with this level of clarity before? He sighs, or is this the first time you've encountered them discussed this directly? Your perspective may encourage another man who has quietly carried the same questions for years without knowing where to find honest answers. Conversations like these help replace myths with knowledge, allowing more couples to build stronger relationships based on mutual understanding, respect, emotional connection, and genuine partnership. As we bring this discussion to a close, I want you to carry one important truth forward with you. The strongest intimate relationships are not built on flawless performance or physical technique alone. They are built on knowledge, patience, trust, and the genuine willingness to understand your partner more deeply with each shared experience. The biological responses we've explored today are powerful reminders that meaningful intimacy is a shared experience in which the brain, the nervous system, the endocrine system, the circulatory system, and the emotional bond between two people all participate simultaneously. When you understand how those systems interact, you stop approaching closeness as something to accomplish, and you begin approaching it as something to nurture. That shift in perspective alone often transforms the quality of a relationship more profoundly than any other change a couple can make. Every thoughtful conversation, every moment of deliberate patience, every act of genuine kindness, and every effort to make your partner feel emotionally safe and understood contributes to a healthier, more deeply satisfying connection. Those choices accumulate over time. They become the foundation of lasting trust and real affection, the kind that doesn't fade with age, but deepens with it. Remember, healthy intimacy continues to evolve throughout every stage of life. Growing older does not mean losing the capacity for closeness, affection, or fulfillment. It means developing the maturity, the knowledge, and the communication skills that allow intimacy to become richer and more meaningful than it may ever have been before. Continue caring for your physical health. Prioritize sleep, nutrition, and cardiovascular wellness, all of which support the vascular function that underpins healthy sexual response at every age. Communicate openly with your partner, respect each other's feelings without judgment, and never stop learning together. Because the science of the human body and the science of human connection are both endlessly deep. If today's discussion gave you a clearer picture of what your partner experiences and why emotional presence matters as much as anything else, consider sharing this video with someone who could benefit from this information. Together, we can replace decades of misinformation with genuine understanding and help more couples build stronger, healthier, more fulfilling relationships at every stage of life. Thank you for spending this time with me. I'm Dr. Richard Ben, and I look forward to seeing you in our next conversation where we'll continue exploring the science of healthy aging, men's wellness, and the biology of stronger relationships. Until then, take care of yourself, value your partner, and keep choosing understanding every single day.